Welcome to Nclex Made Easy 91. Today's topic, Nclex trick, always pick the right answer, secret hack. This is a full set of 50 tough Nclex style questions designed to train your brain to spot the best option under exam pressure. Each question includes answer, rationale, clear explanation of why it's correct and why others are wrong, strategy, how to solve similar questions fast. Let's dive in and sharpen your test-taking skills. Question 1. A client with chronic COPD is receiving home oxygen at 2 liters per minute via nasal cannula and reports increasing dyspnea. Which immediate action is best for the nurse to take? A. Increase oxygen to 4 liters per minute. B. Assess respiratory rate, effort, and SpO2. C. Instruct the client to perform pursed lip breathing only. D. Call the physician to change the medication. Answer, B. Assess respiratory rate, effort, and SpO2. Rationale, before making changes, always gather more data. Increasing oxygen without assessment can suppress hypoxic drive in COPD patients. Calling the provider or giving teaching would delay necessary assessment. Strategy, think, assessment before action. Unless there's an immediate life-threatening situation where action is obvious, e.g., airway obstruction, assessment is the safest first step. Question 2. A postoperative client on PCA morphine has a respiratory rate of 8 per minute and is very drowsy. Which medication should the nurse anticipate administering? A. Flumazenol. B. Naloxone. C. Physostigmine. D. Protamine sulfate. Answer, B. Naloxone. Rationale, naloxone reverses opioid-induced respiratory depression. Flumazenol reverses benzodiazepines, physostigmine is for anticholinergic toxicity, and protamine sulfate is for heparin overdose. Strategy, match antidotes to the culprit drug. PCA morphine equals opioid, think naloxone saves lives. Question 3. A client with DKA has blood glucose 480 mg per deciliter, pH 7.18, and K 5.6 milliequivalent/L. The nurse should prepare to A. Administer 4 regular insulin and monitor potassium closely. B. Give 4 potassium chloride immediately. C. Administer sodium bicarbonate and hold insulin. D. Start a hypotonic 4 fluid infusion. Answer, A. Administer 4 regular insulin and monitor potassium closely. Rationale, insulin lowers blood glucose and shifts potassium into cells, potentially causing hypokalemia. Potassium is only supplemented if low. Sodium bicarb is rarely used unless pH less than 6.9. Strategy. Follow DKA priorities: 1. Fluids, 2. Insulin, 3. Electrolytes. Always anticipate a potassium drop when insulin is started. Question 4. A client on warfarin has 5.5 Indian rupees but no bleeding. Which action is best? A. Administer oral vitamin K and hold warfarin. B. Give fresh frozen plasma. C. Increase warfarin dose. D. Repeat INR in a week. Answer, A. Administer oral vitamin K and hold warfarin. Rationale, INR 5 but 9 with no bleeding requires holding warfarin and giving oral vitamin K to prevent spontaneous bleeding. Plasma is only used if there's active bleeding. Strategy, no therapeutic INR, 2 to 3 for most patients. If elevated, hold drug plus vitamin K if above 5. Question 5. The RN delegates vital signs for a stable post-op client to a nursing assistant. What is the most appropriate RN action? A. Provide parameters, document delegation, review results. B. Allow NA to notify physician directly if abnormal. C. Reassign task to another RN. D. Do vitals personally because client is new. Answer, A. Provide parameters, document delegation, review results. Rationale, delegation requires clear instructions and follow-up. The RN retains responsibility and must interpret results, not the NA. Strategy, remember 5 rights of delegation: right task, circumstance, person, direction, supervision. Question 6. A client receiving gentamicin reports hearing loss and dizziness. Which is the best action? A. Continue drug and reassess later. B. Hold drug and notify provider. C. Administer antiemetic. D. Check creatinine later. Answer: B. Hold drug and notify provider. Rationale: gentamicin is nephrotoxic and ototoxic. Hearing changes must be reported immediately to prevent permanent damage. Strategy: Nclex loves stop drug plus notify provider for severe adverse effects. Question 7. A new tracheostomy client has subcutaneous emphysema at the site and increasing dyspnea. What is priority? A. Remove trach and prepare for intubation. B. Apply dressing and call provider. C. Suction trach and assess breath sounds. D. Increase humidification. Answer: C. Suction trach and assess breath sounds. Rationale: dyspnea equals airway problem. Suctioning clears obstruction and confirms patency before other interventions. Strategy: airway comes first, ABCs. Question 8. A client on heparin infusion has APTT 95 seconds, therapeutic 60 to 80. Which action is best? A. Continue infusion. B. Stop infusion and give protamine sulfate. C. Increase infusion rate. D. Get CT scan. Answer: B. Stop infusion and give protamine sulfate. Rationale: APTT greater than 80 equals too high bleeding risk, hold drug plus antidote. Strategy: memorize therapeutic APTT range, 1.5-2.5 times normal. Question 9. An elderly client with UTI is wandering. Best action? A. Apply restraints. B. Place near nurse's station and use alarm. C. Keep lights off. D. Restrict fluids. Answer: B. Place near nurse's station and use alarm. Rationale: least restrictive, safest option. Restraints are last resort. Strategy: choose least restrictive, most effective intervention first. Question 10. Pregnant client at 28 weeks tests positive for rubella. Which teaching is most important? A. No action needed. B. Discuss fetal risk and genetic counseling. C. Recommend MMR vaccine. D. Start antivirals. Answer: B. Discuss fetal risk and counseling. Rationale: rubella during pregnancy can cause congenital defects. MMR is contraindicated until postpartum. Strategy: no live vaccines during pregnancy, key Nclex point. Question 11. Client with K6.3 and peaked T waves is admitted. What is priority? A. Prepare for calcium gluconate. B. Give oral K-exalate. C. Start spironolactone. D. Restrict dietary potassium. Answer: A. Prepare for calcium gluconate. Rationale: calcium stabilizes myocardium and prevents arrhythmias. K-exalate acts slowly. Strategy: treat the heart first in hyperkalemia, then remove K. Question 12. Which drug combo poses greatest bleeding risk? A. Aspirin plus omeprazole. B. Warfarin plus metronidazole. C. Lisinopril plus spironolactone. D. Metformin plus statin. Answer: B. Warfarin plus metronidazole. Rationale: metronidazole increases warfarin effect bleeding risk. Strategy: no common drug interactions, warfarin, digoxin, lithium. Question 13. Newborn has SpO2 88% right hand, 75% foot, murmur and cyanosis. This suggests: A. Transposition of great arteries. B. Pneumonia. C. PDA with RL shunt. D. Normal. Answer: A. Transposition of great arteries. Rationale: big pre/post-ductal difference equals congenital cyanotic heart defect. Strategy: identify red flags, cyanosis plus low O2 plus murmur equals CHD. Question 14. Before starting dabigatran for AFib, check A. INR. B. Creatinine clearance. C. Platelets. D. LFTs. Answer, B. Creatinine clearance. Rationale, dabigatran is renally cleared, impaired kidneys equals bleeding risk. Strategy, always assess renal function before dose. Question 15. Diabetic client scheduled for CT with 4 contrast. Which drug hold? A. Metformin. B. Insulin glargine. C. Lisinopril. D. Aspirin. Answer, A. Metformin. Rationale. Contrast plus metformin equals lactic acidosis risk hold 24 to 48 hours. Strategy, remember, hold metformin before contrast. Question 16. Client in septic shock needs fluids. Which fluid best first? A. D5W. B. NS. C. 3% saline. D. LR. Answer, D. LR. Rationale, LR is balanced crystalloid and preferred for resuscitation. Strategy, choose isotonic crystalloids for shock, LRNS. Question 17. Stroke client arrives in 2 hours. Which finding contraindicates TPA? A. Symptoms 90 minutes ago. B. Platelets 80,000. C. NIH score 10. D. Glucose 110. Answer, B. Platelets 80,000. Rationale, low platelets equals bleeding risk no TPA. Strategy, memorize TPA contraindications. Question 18. A client with heart failure is prescribed spironolactone. Which electrolyte should be monitored most closely? A. Hypokalemia. B. Hyperkalemia. C. Hypernatremia. D. Hypocalcemia. Answer, B. Hyperkalemia. Rationale, spironolactone is a potassium-sparing diuretic. Retention of potassium may lead to dangerous hyperkalemia, causing arrhythmias. Strategy, link drug class effect. Potassium-sparing equals risk for high potassium. Nclex often tests which lab to monitor. Questions. Question 19. A client with a spinal cord injury suddenly develops severe hypertension, pounding headache, and flushing. What is the priority nursing action? A. Lower the HOB and check bladder. B. Sit the client upright and check for bladder distension. C. Apply cold packs and recheck BP later. D. Administer antihypertensive medication first. Answer, B. Sit the client upright and check for bladder distension. Rationale, these symptoms indicate autonomic dysreflexia. First action, elevate head to lower BP and find/remove trigger, often bladder distension or fecal impaction. Antihypertensives come after non-pharmacologic measures fail. Strategy, ABCs first remove the cause. Nclex tests, what do you do first? Always treat cause, not just symptom. Question 20. A client is suspected to have Clostridium difficile infection. Which action is most appropriate? A. Place on airborne precautions. B. Place on contact precautions and wash hands with soap and water. C. Use alcohol-based sanitizer only. D. Place client in negative pressure room. Answer, B. Contact precautions and soap and water. Rationale, C. Diff spores are resistant to alcohol-based sanitizers, handwashing with soap and water is required. Gloves and gown must be worn. Strategy, memorize infection control categories. Contact equals gloves plus gown plus dedicated equipment. Question 21. A client receiving furosemide has muscle cramps and irregular heartbeats. Which lab value explains these findings? A. K 2.8 milliequivalent/L. B. Na 142 milliequivalent/L. C. Ca superscript 2 9.0 mg per deciliter. D. Mg superscript 2 1.9 mg per deciliter. Answer, A. K 2.8 milliequivalent/L. Rationale, furosemide causes potassium loss. Hypokalemia leads to arrhythmias and cramps. Strategy, loop diuretics equals watch potassium. Always choose potassium abnormality in these questions. Question 22. A nurse prepares to administer digoxin to a client. Which finding requires holding the medication? A. HR 88 BPM. B. HR 60 BPM. C. HR 48 BPM. D. HR 100 BPM. Answer: C. HR 48 BPM. Rationale: digoxin slows AV node conduction. Hold drug if HR less than 60 BPM to avoid severe bradycardia. Strategy: Nclex loves when to hold digoxin. Remember, less than 60 BPM equals hold. Question 23. A client with Addison's disease is prescribed hydrocortisone. Which instruction is most important? A. Take drug with meals. B. Do not stop drug abruptly. C. Expect mild weight gain. D. Increase potassium intake. Answer: B. Do not stop drug abruptly. Rationale: sudden withdrawal can trigger adrenal crisis, which is life-threatening. Strategy: safety first, steroids must be tapered. Always pick do not stop abruptly. Question 24. A client with asthma has wheezing suddenly stop and breath sounds become silent. What is priority? A. Document as improvement. B. Prepare for intubation. C. Give sedative. D. Ask client to cough deeply. Answer: B. Prepare for intubation. Rationale: silent chest equals severe airway obstruction impending respiratory arrest. Strategy: Nclex trick, no wheeze in asthma equals bad sign. Prepare for airway management. Question 25. A client with cirrhosis has ascites and is at risk for hepatic encephalopathy. Which order should the nurse question? A. Lactulose PO. B. Spironolactone PO. C. High protein diet. D. Paracentesis PRN. Answer: C. High protein diet. Rationale: excess protein increases ammonia production, worsens encephalopathy. Low protein diet is required during acute encephalopathy. Strategy: when in doubt, think liver failure equals low protein to reduce ammonia. Question 26. A client with suspected meningococcal meningitis is admitted. Which action is priority? A. Administer 4 antibiotics. B. Obtain consent for lumbar puncture. C. Place on droplet precautions. D. Administer antipyretics. Answer: C. Place on droplet precautions. Rationale: first action is to prevent transmission. Antibiotics can follow. Strategy: Nclex loves infection control first before treatment. Question 27. Which food choice should a client taking MAOIs avoid? A. Baked chicken. B. Fresh apple. C. Aged cheddar cheese. D. Plain rice. Answer: C. Aged cheddar cheese. Rationale: tyramine foods, aged cheese, wine, cured meats, can cause hypertensive crisis with MAOIs. Strategy: memorize tyramine foods avoid for Nclex. Question 28. A client receiving 4 vancomycin develops flushing, hypotension, and pruritus. What should the nurse do first? A. Discontinue infusion and call provider. B. Slow infusion rate. C. Administer antihistamine. D. Document and continue. Answer: B. Slow infusion rate. Rationale: this is red man syndrome, not an allergy. Slow rate and give antihistamine if needed. Strategy: Nclex tests difference between allergy versus rate reaction. Question 29. A client has been taking phenytoin. Which statement needs teaching? A. I will visit my dentist regularly. B. I may notice overgrowth of my gums. C. I will stop the drug if I get a rash. D. I can skip doses if I feel well. Answer: D. I can skip doses if I feel well. Rationale: phenytoin must be taken consistently to maintain therapeutic levels. Strategy: Nclex loves compliance questions, never skip AEDs. Question 30. A nurse is caring for a client with myasthenia gravis. Which drug should be kept ready for cholinergic crisis? A. Epinephrine. B. Atropine. C. Naloxone. D. Protamine sulfate. Answer: B. Atropine. Rationale: atropine is antidote for cholinergic crisis, XSACH. Strategy: match antidote to toxicity. Cholinergic crisis equals atropine. Question 31. A client with burns develops dark red urine. Which is priority? A. Notify provider and increase fluids. B. Continue to monitor urine color. C. Obtain urinalysis only. D. Restrict fluids. Answer: A. Notify provider and increase fluids. Rationale: dark urine may indicate myoglobinuria risk for acute kidney injury. Strategy: Nclex rule, treat perfusion and kidney protection early. Question 32. A client with SIAD is receiving 3% saline. Which finding requires immediate action? A. NaL 130 milliequivalent/L. B. NaL 155 milliequivalent/L. C. BP 110 of 70. D. Dry mucous membranes. Answer: B. NaL 155 milliequivalent/L. Rationale: rapid correction of hyponatremia. Hypernatremia equals central pontine myelinolysis risk. Strategy: Nclex trick, correct sodium slowly. Question 33. A nurse finds a client seizing. What is the priority action? A. Place padded tongue blade. B. Turn client to side and protect head. C. Hold down client's arms. D. Give water after seizure. Answer: B. Turn client to side and protect head. Rationale: prevent aspiration and head injury. Never insert objects or restrain. Strategy: choose airway safety first in seizure questions. Question 34. A client receiving chemotherapy has WBC 1000/mm superscript 3. Which precaution is priority? A. Place on neutropenic precautions. B. Place on contact isolation. C. Administer live vaccines. D. Restrict protein intake. Answer: A. Neutropenic precautions. Rationale: very low WBC equals infection risk, reverse isolation needed. Strategy: Nclex trick, ANC less than 1000 equals high infection risk. Question 35. Which insulin can be given for? A. Regular. B. NPH. C. Lispro. D. Glargine. Answer: A. Regular. Rationale: only regular insulin is given for emergencies like DKA. Strategy: memorize, regular equals 4. Question 36. A client develops malignant hyperthermia during surgery. Which drug saves life? A. Succinylcholine. B. Dantrolene. C. Atropine. D. Midazolam. Answer: B. Dantrolene. Rationale: dantrolene relaxes skeletal muscles, reversing malignant hyperthermia. Strategy: high-yield Nclex fact, malignant hyperthermia. Dantrolene. Question 37. Which lab must be monitored for client on clozapine? A. CBC/WBC. B. Creatinine. C. AST/ALT. D. TSH. Answer: A. CBC/WBC. Rationale: clozapine causes agranulocytosis. Monitor WBC weekly. Strategy: Nclex trick, clozapine infection risk. Question 38. A client is taking lithium. Which finding needs priority intervention? A. Tremor of hands. B. Increased thirst. C. Ataxia and confusion. D. Weight gain. Answer: C. Ataxia and confusion. Rationale: these indicate lithium toxicity, greater than 2.0. Strategy: no therapeutic lithium range, 0.6 to 1.2. Question 39. A nurse prepares to administer for potassium. Which action is unsafe? A. Diluting potassium in 100 ml NS. B. Giving potassium for push. C. Using infusion pump. D. Checking kidney function. Answer, B. Giving potassium for push. Rationale, for push potassium can cause cardiac arrest. Must be diluted and infused slowly. Strategy, Nclex high yield, never for push K. Question 40. A client with asthma is prescribed theophylline. Which finding is most concerning? A. Mild insomnia. B. Nausea and vomiting. C. HR90. D. Occasional cough. Answer, B. Nausea and vomiting. Rationale, early sign of theophylline toxicity. Strategy, no therapeutic level, 10 to 20. NV equals early toxicity sign. Question 41. Which client should the nurse see first? A. Chest pain relieved by rest. B. Sudden onset of shortness of breath post-surgery. C. Fever after antibiotics. D. Hemoglobin 10G/DL. Answer, B. Sudden SOB post-surgery. Rationale, could be pulmonary embolism, life-threatening. Strategy, Nclex priority, ABC plus acute chronic. Question 42. Client with NG tube develops metabolic alkalosis. Cause? A. Loss of gastric acid via suction. B. Diarrhea. C. Kidney failure. D. Excess K intake. Answer, A. Loss of gastric acid via suction. Rationale, NG suction removes HCl alkalosis. Strategy, think about acid/base loss. Question 43. Client with acute pancreatitis should avoid which food? A. Grilled chicken. B. Low-fat yogurt. C. Bacon and eggs. D. Rice. Answer, C. Bacon and eggs. Rationale, high-fat foods worsen pancreatic stimulation. Strategy, pancreatitis equals NPO or low-fat diet once eating resumes. Question 44. A client on long-term steroids is at risk for A. Hypoglycemia. B. Osteoporosis. C. Hypotension. D. Weight loss. Answer, B. Osteoporosis. Rationale, steroids cause bone resorption and thinning. Strategy, Nclex, steroids moon face, thin skin, bone loss. Question 45. Which finding is most concerning in a client on TPN? A. Blood glucose 120. B. Temp 101 degrees Fahrenheit. C. Slight weight gain. D. Mild edema. Answer, B. Temp 101 degrees Fahrenheit. Rationale, fever could indicate catheter-related sepsis. Strategy, Nclex priority, infection risk with central line nutrition. Question 46. A client develops compartment syndrome after fracture. What is priority? A. Elevate limb above heart. B. Apply ice. C. Notify provider and prepare for fasciotomy. D. Continue neuro checks. Answer, C. Notify provider and prepare for fasciotomy. Rationale, fasciotomy is definitive treatment. Delays necrosis. Strategy, Nclex, compartment syndrome equals emergency surgery. Question 47. Client with peritoneal dialysis has cloudy effluent. What does this indicate? A. Normal finding. B. Peritonitis. C. Fistula leak. D. Hypervolemia. Answer, B. Peritonitis. Rationale, cloudy effluent equals infection. Strategy, always report cloudy PD fluid, early peritonitis sign. Question 48. Which statement shows proper use of nitroglycerin SL? A. I swallow the tablet with water. B. I can take up to 3 tablets, 5 minutes apart if pain persists. C. I take it on a full stomach. D. I store it in my bathroom cabinet. Answer, B. Up to 3 tablets, 5 minutes apart. Rationale, correct teaching. 1 tab Q 5 minute x 3 max call EMS if pain persists. Strategy, Nclex tests nitro teaching, dark bottle, replace every 6 mO. Question 49. Client post-thyroidectomy develops hoarse voice, tingling lips, and spasm. Priority? A. Reassure as normal. B. Check Schwastek sign and prepare for calcium. C. Increase fluids. D. Monitor only. Answer: B. Check Schwastek and prepare calcium. Rationale: hypocalcemia due to parathyroid injury can cause tetany laryngeal spasm. Strategy: Nclex, airway plus calcium equals priority after thyroid surgery. Question 50. Client receiving blood transfusion developed chills, fever, back pain. First action? A. Slow infusion. B. Stop transfusion and keep line open with NS. C. Give antipyretic. D. Notify blood bank after transfusion. Answer: B. Stop transfusion and keep line open with NS. Rationale: this is an acute hemolytic reaction, stop blood immediately to prevent kidney damage. Strategy: Nclex, stop blood first save line with NS notify provider. Great job! You just completed 50 of the toughest Nclex style questions on Secret Hack. Review rationales carefully, they teach you why an answer is right and why the others are wrong. Practice using these critical thinking strategies so that, on exam day, you'll confidently pick the best answer every time.